Hi everyone, my name is Abby Rigandine and I selected the case study I submitted on COVID-19 communication challenges for this healthcare leadership symposium assignment because it is relevant to current events and this healthcare communications course. Quick background, COVID-19 first emerged in Wuhan, China in December 2019. And after a short period of time, as cases were detected in other parts of China, it became an outbreak. And since then, it has been declared a global pandemic by the World Health Organization. Now we'll talk about the main points in the case study. Summarizing the key challenges, effective communication is key in all aspects of life, especially in public health. The key elements presented in the study were news being fear-generating, different cultures and experiences with the pandemic in different parts of the world, resulting in different communication strategies in various countries, misinformation on social media and fake news on the internet, which is in part due to the lack of regulation on social media, and how there is a need for us, the consumers, to fact check our sources of information or only use trustworthy sources of information. Next, we'll talk about the recommendations to mitigate the issues stated above. Summarizing the recommendations, there are two. One is that government and social media networks can work together to ensure that only accurate information is shared on these platforms. Currently, government authorities and public health agencies at all levels already use social media because it reaches a lot of people very quickly. They use interactive media such as photos and videos because they're more likely to be given attention to and shared by people. The second recommendation is for government and public health agencies to work together to educate community members on the signs of fake news or inaccurate information online. As a consumer, there is a need to fact check and only get information from reputable sources. Next is the critique of the case study, highlighting strengths and weaknesses. So one of the strengths is that it covered a wide scope. As mentioned earlier, the study talked about news being fear-generating, different cultures, and how different countries had different communication strategies based on their experiences with the pandemic, misinformation on social media and fake news, and that consumers need to learn to fact check their sources before sharing information with others. Another strength is that there were relevant references and the issues were all related to communication. As for weaknesses, because of the wide scope covered, it made it so that the case study slightly lost focus. And then this lack of focus led to arguments not being fully fleshed out. What was lacking in the main points is bringing it home, which could have been done with additional references or resources. Finally, the discussion questions here are piggybacking from the discussion questions from the case study itself. One, how can media and government in one nation work together to ensure that the information being disseminated is accurate? Two, to address differences in culture, how can government agencies of different countries collaborate to ensure alignment of communication? Three, how can information be verified as fact prior to being shared? And four, how can government agencies engage with communities to educate community members about how to identify when information is false? So in conclusion, communication is needed by all people. So there really is a need for open lines of communication, but also for information to be accurate. Sometimes false information going out can be between life and death. In the future, implementing regulation on social media platforms and the internet would be beneficial for the common good. This can be achieved by government leaders and social media companies collaborating with each other. Another solution to be explored is to educate people how to fact check information online and use only trustworthy sources. Thank you for listening to this presentation on the case study COVID-19 communication challenges. I look forward to hearing about what you think.